This video will help you understand the changes that might happen in your body if you're transgender or gender diverse and take estrogen or estradiol for gender affirming care. Changes are to some degree based on the dose and length of treatment, as well as your pre-existing changes and exposure to testosterone, the age when you start treatment. It's definitely hard to pick and choose individual changes from estrogen or estradiol therapy, but here at QueerDoc, we do love supporting individualized treatments based off of someone's goals and desires for their body. We believe gender is infinite and want to help you find the treatment that fits best, whether it involves estrogen or not. Additionally, sometimes there are other medications we can use to try to target specific goals. So please let your provider know. Estrogen is the hormone made by our bodies. Bodies with ovaries usually make more of it than bodies with testicles, but most all bodies make it. It can also be made in a lab. The estrogen we prescribe at QueerDoc is made in a lab, but it has the same chemical structure as the estrogen made by our bodies. We often call this type of hormone bioidentical. The form of estrogen we prescribe is called estradiol. Oftentimes the word estrogen and estradiol get used interchangeably within community. And so we're going to use estradiol moving forward as it's the most medically accurate term. Estradiol does many things in the body, and if you start taking it, your body will change. These changes may be something you want, which we might call a benefit, or something you don't want, which we would call a side effect or potentially a risk. Your set of benefits, side effects, and risk is unique to you and depends on what you want for your body. We will try to give a general timeline in this video of when these changes will occur, but we can't predict it exactly. The timing of when changes start varies by individual and dose taken. Most changes happen gradually, so if you notice something you don't like or don't want, you usually have time to talk to your clinician and decide if you want to slow down or stop taking estradiol. These changes can be permanent, semi-permanent, or transitory, meaning they go away if you stop estradiol in the future. We will mention in this video when we talk about changes that are permanent or semi-permanent. If we don't specifically say that, then the change is transitory and will go back or change back to how it was before you took estradiol if you stop estradiol. Most changes with estradiol are transitory, with the exception primarily of breast development. All right, section 2. Estradiol can cause these changes in your body. Decreased thinning or hair loss of your head. Some hair loss is driven by testosterone exposure. Estradiol decreases the body's production of testosterone, so you are less likely to have hair loss related to testosterone. Once the hair falls out, the hair follicle has about a year before it loses the ability to grow a new hair. If you start estradiol before that hair follicle stops being able to support a new hair, you might notice some regrowth of lost hair. Estradiol can slow the growth of facial and body hair. This is a highly varied response. Some folks don't see any slowing at all, and some folks definitely see some. We don't know your experience until you try. For facial and body hair that is coarser and darker, so that's something we call a terminal hair in medicine, treatment with laser or electrolysis is the primary option for removal. Estradiol does not stop the growth of already developed facial and body hair. It can slow or prevent the development of more new facial and body hair. So if you have villus hairs, more like peach fuzz, estrogen treatment can prevent the conversion of them to terminal hairs. It's also common for facial and body hair to lose pigment, turn gray or white faster on estradiol therapy. And this can interfere with laser hair removal because laser hair removal often targets hair pigment color. Voice. Estrogen does not affect voice. If your vocal cords have already thickened from testosterone exposure in puberty, your voice dropped already, estradiol will not change the sound or quality of your voice. You can change the sound and quality of your voice by working with a vocal transition specialist, doing a voice transition program, or working with a speech language pathologist. You also might choose to pursue a surgery. Surgery typically only affects pitch, and there are several other ways in which voice is, gender is interpreted into voice by society. That includes resonance, vocal weight, vocal tilt, and vocal dynamics. And those things are typically only changed by working through behavioral patterns And so that's typically with a speech language pathologist, a vocal transition coach, or online voice change program. Estrogen will make your skin softer and thinner and potentially have less acne. Skin responds to estrogen by getting thinner, less oily, and softer to the touch. Estradiol tends to decrease a sebum secretion from sebaceous glands and makes pores smaller, so you might be less prone to acne. These skin changes often actually make your skin more sensitive to touch, so how you feel touch will change, and how it feels when you touch things might change as well. Estradiol changes your body odor, so your body odor will change. It will just smell differently. Also, you may smell less strong less quickly. Sweat and body temperature change with estradiol therapy. It can decrease your basal body temperature, and you might find that you feel hot less often or cold more easily. You may just notice that you sweat less often or less profusely. Estradiol affects fat redistribution and fat storage. The layer of fat under your skin will probably get thicker. So subcutaneous fat. This can give you a softer, less angular and veiny appearance in your face, body, arms, and legs. So you might look a little less cut. You'll also tend to store more fat around your butt, hips, and thighs region, which can give a slightly curvier silhouette. A lot of that curve in a silhouette is determined by your underlying hip or pelvis bone. Right, we talk a lot about waist to hip ratios and how people try to interpret someone's gender. And so we can't affect the pelvis bone with hormone therapy. And so some people find that the weight redistribution, which takes years to kind of fully develop, doesn't give them enough change in that waist to hip ratio and might choose to pursue things like hip pads or body contouring surgery procedures. Estradiol can give you more delicate muscles. It will decrease the size and strength of muscles. Right, there's some really mixed data on how it affects overall sports performance, but it does seem to decrease muscular strength and size. And when your estradiol is adequately suppressing your testosterone production, it will be incredibly hard, if not impossible, to bulk up exercising. So we do highly encourage weight-bearing exercise, as it reduces your risk of osteoporosis, which is increased when you start taking estradiol therapy. Targeted weightlifting exercises can also help with body shape and presentation goals. Estradiol causes breast development. Breasts start with breast buds, often in the first 3 to 6 months of treatment. The bulk of development will happen in the first 2 years. Some limited quality research, really limited, suggests that a lower starting dose of estradiol and slower titration upward might improve volume of breast development overall. Uncertain. Knowledge from intersex folks and cis folks suggests that progesterone is also important for breast development, but needs to be delayed at least 6 months of estrogen therapy to avoid more tubular, less round-shaped breasts, which generally people find less aesthetic. Like we said previously, breast development is a permanent change with estradiol therapy. If you stop estradiol therapy in the future, breast tissue will remain. It will become less full and firm. And there are some medications you can use to try to reduce it, but won't necessarily fully reduce in size. And there's surgical removal options as well. Estradiol can cause weight change. You may gain some weight and find it harder to lose weight. This can actually benefit breast development and fat redistribution, just because this is a second puberty and calories are essential for building new body parts. Genital changes with estradiol. Erections may become less frequent and firm. Ejaculate volume decreases and can go away. Genital changes with estradiol therapy. Erections will become less frequent. Well, erections may be genital changes with estradiol therapy. Erections may become less frequent and less firm. Ejaculate volume decreases and can even fully go away for some people. The taste, smell, and appearance of the ejaculate changes. It becomes more clear and less cloudy. You may experience changes in the way sexual stimulation or pleasure feels. Often orgasms are described as more of a full body sensation, definitely a pelvic sensation than just a genital sensation. You should still be able to achieve orgasm, but you may need to use different techniques to get off, and it may feel different than how it did previously. You may find that what you're sexually attracted to, what turns you on, changes. There are several interventions available to minimize effect on erections and genital changes, so definitely let your provider know if you're interested in those. Estradiol does cause genital atrophy. So estradiol changes the tissues of your genitals, and the shaft and testicles will get smaller over time. There can sometimes be discomfort or pain associated with erections when this is happening. Also, urinary symptoms like burning or difficulty urinating. So definitely talk with your clinician if you're experiencing that, as there are some interventions we can try. Estradiol, like we've been talking about, can affect sex stuff as well. It can make you think about sex less often or less intensely. It might change what you find sexually interesting or appealing, like what you're attracted to and what gets you off. And you might find that you need more mental stimulation than visual stimulation to achieve orgasm. Estradiol affects prostate, so testosterone exposure and prostate cancer are linked. And because estradiol decreases testosterone production and thus prostate exposure to testosterone, we do think you're less likely to develop prostate cancer if you're on estradiol therapy. Estradiol therapy decreases fertility. Definitely, this is also affected by duration of estradiol treatment, dose of estrogen, and your age. While you are much less fertile while on estradiol therapy, it's not birth control. It's not guaranteed infertility. So 1 in 5 people still make sperm. Several people who started estradiol therapy after puberty have stopped it to reaccess fertility successfully. However, research does show that transgender and gender diverse folks are more likely to have fertility issues even prior to starting estradiol therapy than their cis peers. Many people do choose to preserve genetic material before starting estradiol therapy. And if you would like to do this, you want to do it before starting any gender affirming medications because they will affect the quality of the sample. Estradiol affects emotional stuff for sure. Mood and emotional changes are often the first thing you'll notice, even within a few days to few weeks of starting estradiol. People often report feeling improved mood, happier, calmer, better. They often describe their emotional experience on estradiol as more complex, varied, or brighter. It's common for people to describe the world being in black or white or gray scale before taking estradiol, and then to be in like full color after starting estradiol therapy. It seems to increase the diversity and variety of feelings possible or feelings experienced. And so you may notice, because there are more possible feelings to have, more frequent shifting between emotional experiences. It's also common to be more easily tearful and access empathy more easily for others. Estradiol can affect your physical safety and increase discrimination. So the more visibly trans we are, the more risk of minority distress, discrimination, and physical violence. And these risks are definitely amplified by any intersexual identities. Section 3. Data is limited, but there are some known possible risks with estradiol therapy. Cardiovascular disease is commonly known as heart disease. Heart disease is a group of conditions that lower the heart's ability to pump blood or the body's ability to get oxygen-rich blood to all of its parts. Cardiovascular disease does occur at higher rates among transgender and gender diverse people, but we believe that to be related to minority stress. Minority stress is the additional impact to daily life caused by prejudice and bigotry. We don't have a lot of research about changes in heart disease risk for transgender people taking estradiol, but we currently think that estradiol slightly decreases your overall risk of cardiovascular disease. A few changes on estradiol are often associated with higher risk of cardiovascular disease, like weight gain, increased body fat percentage, and how fat is stored. Additionally, your triglyceride level will probably go up. However, the likely decrease in your LDL cholesterol and homocysteine levels seem to help protect your heart and blood vessels. Blood clot risk. Your risk of a blood clot increases with estradiol therapy. An average young adult with no other risk factors, blood clot risk is estimated to be 1 in 1,000, and we think estradiol is going to double that to 2 in 1,000. That risk is actually going to increase with time. So the longer you're on estradiol therapy and the older you get. Estradiol we use in gender affirming care does seem less likely to cause blood clots than the estrogens we use in birth control. Blood clots can be deadly, so talk to your provider about signs and symptoms to watch for. And if you've had a family member with a history of blood clots, it's important, or you've had a blood clot, it's important to discuss your options with your prescriber, as you might want to consider alternatives to estradiol therapy, alternative ways to take your estradiol therapy, or additional medications in addition to estradiol to reduce your risk of a blood clot. Strokes. A stroke is when the blood supply to the brain is limited or stopped, or a blood vessel inside the brain bursts. The data is mixed, but overall, estradiol treatment seems to decrease the risk of having a stroke. Breast cancer. Estradiol exposure is linked to breast cancer. The more estradiol exposure over time and quantity of time to exposure, the higher the risk. Optimizing your estradiol dose to the lowest effective dose decreases the risk of breast cancer as you age. Trans people taking estradiol still have breast cancer at lower rates than cis women, but do seem to develop it faster than expected based on data from cis women. Please talk to your prescriber about when you should consider breast cancer screening. Diabetes. Diabetes is the body needing more insulin to be able to manage sugar or glucose in the blood. Estradiol does not seem to increase your risk of developing diabetes, but if you already have diabetes, starting and changing your dose of estradiol may affect your insulin needs. So work closely with your diabetes management team to watch your sugars during those times. Thyroid conditions. Estradiol may increase the likelihood of several autoimmune conditions, including thyroid diseases. Estradiol can also decrease the effectiveness of thyroid medications. So make sure you're working with your prescriber to monitor your thyroid medication needs when starting and changing estradiol doses. There are several health conditions we find more commonly in bodies with more estrogen: migraines, fibromyalgia, gallbladder disease, and autoimmune conditions like MS or lupus. Your risk of these is theoretically going to increase if you take estradiol therapy. Section 4. We do encourage appointments and regular blood work to help keep an eye on some of these risks. We usually recommend visits and blood work every 3 months and your first 1 to 2 years of treatment. Baseline blood work or lab tests may be recommended. Section 4. We do encourage appointments and regular blood work to keep an eye on some of these risks, usually every 3 months and your first 1 to 2 years of therapy. Baseline blood work or lab tests may be recommended. Our recommendations will be Section 4. We do encourage appointments and regular blood work to help keep an eye on your progress and monitor some of these risks. We usually recommend a visit and blood test every 3 months in your first 1 to 2 years of therapy. Baseline blood work or lab tests are recommended. Our recommendations will be based on your pre-existing health conditions, other medications you take, your goals for your care, the treatment options you're considering, and your personal values. Some people may choose to decline baseline tests, but will need to talk to their doctor about the risk involved. Estradiol can be taken in many ways: pills, patches, injections, gels, pellets. Pills and injection are the most common forms of estradiol used in gender-affirming care because they tend to be the most affordable and accessible, plus dosages are most easily individualized and changed. Pills are taken daily or even multiple times a day. Most estradiol pills in the United States are micronized, so that does mean you can swallow them or place them under the tongue for sublingual administration. Injections in the United States typically involve cypionate or valerate, and while those were designed for intramuscular injection, we actually recommend trying subcutaneous injections. You can learn more on a self-injections page. Injections are usually done once a week or twice a week. Thanks so much for learning all about estradiol with us. There are other medications we sometimes use in gender-affirming care, like progesterone, testosterone blocking medications, and even more. So we encourage you to talk to your clinician about those individual goals and other treatment options.